This video has been provided by the Home Infusion CLABSI Prevention Collaborative. Thank you in advance for watching this video. This video focuses on types of intravenous or IV lines you might have in the home. Intravenous lines allow medications, fluids, and nutrition to be delivered directly into a vein without needing a new needle stick each time. They start outside the skin and end inside a vein. Types of IV lines used in the home include peripheral IV lines, midlines, PICCs, tunneled central venous catheters, and ports. The ways to clean, flush, and use the IV lines are similar for peripheral IVs, midlines, PICCs, or tunneled central venous catheters. The ways to access a port are different, as ports require a special needle. If you have a port, follow the instructions to access the port. Follow your nurse's instructions about how to flush your peripheral IV, midline, PICC, or tunneled central venous catheter, and how frequently, including both lumens if there is more than one lumen to the IV line. If you have a port, your medical team will tell you how frequently to flush it. Be sure to monitor for the IV line very carefully when bathing. Keep the IV line close to your arm by securing it with a mesh sleeve or sock when you are not using it. This will make it less likely that the line could get pulled out. It is important to wash your hands frequently. You should wash your hands before handling the IV line or your medications, before and after cooking, before and after eating, whenever they are soiled, after contacting high-touch public surfaces such as door handles, and after using the restroom. Soap and water are best. Be sure to wash for at least 20 seconds. Hand sanitizer can be used instead of soap and water, except when your hands are visibly dirty and after using the restroom. Be sure to rub your hands together vigorously with a nickel-sized amount of hand sanitizer for at least 20 seconds. The dressing over the IV line is important in keeping the IV line from getting infected. Keep the dressing clean and dry and keep it away from anything that could make it dirty. If the dressing becomes loose or soiled, let your home infusion agency know right away, as it will need to be changed. Most IV line dressings are changed once a week. Usually, this should be done sterilely by your nurse. Your nurse may teach you or your caregiver how to change the dressing. If your nurse has taught you how to change the dressing, be sure to follow the instructions exactly and to use sterile technique. When your therapy is finished, talk with your doctor about whether you still need your IV line. There is always a slight risk of infection from IV lines. Your nurse may teach you how to remove a peripheral IV or deaccess a port. Never try to remove other types of IV lines on your own. Always feel free to ask your nurse or your pharmacist if you have questions. Some patients may have a peripheral IV line in the home. Peripheral IVs are frequently used in hospitals, emergency departments, surgical centers, and clinics. They are very short and may be easy to place at the bedside and even in the home. These peripheral IVs typically are placed on the hands or arms. Peripheral IVs are only intended to stay in place for a brief period of time, such as a few days to a week. Also, not all medications can be put into a peripheral IV. For these reasons, not all patients can use peripheral IVs in the home. Some patients may have a midline in the home. These midlines are a special type of peripheral IV because they go into one of the veins in the upper arm and end typically in the armpit. They are up to 8 to 10 inches in length, although only a few inches of the midline are outside the skin. Midlines can be placed in a hospital room, a clinic, or a home. Not all medications can be put in a midline, and midlines may not last as long as some other IVs. For this reason, not all patients can use midlines in the home. Some patients may have a PICC in the home. PICC stands for peripherally inserted central catheter. PICCs enter into one of the veins in the upper arm. PICCs then travel through the veins up the arm and into one of the major blood vessels just above the heart. For this reason, PICCs are considered central lines. PICCs can be placed in a hospital room, surgery, interventional radiology suite, clinic, or even a home. PICCs can be up to 24 inches long, but only a few inches of the PICC are outside the skin. PICCs can stay in place for many months. Most medications can be put into a PICC. Many patients who need IVs at home have PICCs. Some patients have tunneled central venous catheters in the home. There are several brands of tunneled central venous catheters, and your healthcare team may refer to the tunneled central venous catheter by its brand name, such as Briovac, Hickman, Neostar, Leonard, Rochong, or Powerline. Tunneled central venous catheters are typically placed in a surgery or an interventional radiology suite. Tunneled central venous catheters are usually placed in your upper chest or neck and go into a large blood vessel in the neck. The tunneled central venous catheter travels under the skin for a few inches before entering the blood vessel. The tip of the tunneled central venous catheter ends just above the heart. The catheter also has a special cuff under your skin so that your tissue can grow around the tunneled central venous catheter, holding it in place. Up to 8 inches of the tunneled central venous catheter are inside the skin and in the vein, but only a few inches are outside the skin. Tunneled central venous catheters can stay in place for many months up to years. Most medications can be given in a tunneled central venous catheter. Some patients may have a Mediport or port in the home. Ports are placed in your upper chest right under your collarbone. The port is about the diameter of a quarter and thickness of a soda bottle cap and is placed in a pocket under the skin to keep it in place. Once it heals, you may not be able to see the port itself, but you can usually feel its outline in your skin. Inside your skin, the port is connected to one of the major veins in your chest. To access the port, you use a special needle. Ports are considered central venous catheters. Ports are typically placed in surgery or an interventional radiology center. Ports can stay in place for months or even years. However, if there is a needle in the port, the needle should be changed weekly. Thank you for viewing this video.